Yes, it is Health Diary. Thank you for making time. My name is Gladys Gashanja and we're coming to you from the Park Inn by Radisson here in Westlands. Now, we are all surrounded by children, whether our own or society's, but the question here is, do we have the skill set to preserve life in case of an accident? Our conversation today is pediatric first aid, and we get to that right after this fact of the matter. Pediatric first aid is the immediate care given to a child or an infant who has been injured or who has become ill prior to the arrival of qualified medical assistance. Statistics show that injuries and accidents are the leading cause of death in children aged between 1 and 14 years, and boys make up 2/3 of that number. Some of the most common injuries or accidents that face children are choking, ingesting poisons, burns or scalds, broken bones, cuts, drowning in swimming pools, putting foreign objects up their nostrils, and nosebleeds. Here now is part 2 of pediatric first aid. So they define pediatric first aid to be the immediate care given to a child or an infant who has been injured or who has been ill prior to the arrival of qualified medical assistance. The question here is, do we even know what to do in case of such a scenario? That's why we're having this conversation today, and to help me have that conversation with us, of course, is Alice Kibagendi. She is a parent and a founder of Amara Initiative, and we have Dr. Super Tunje, who is a pediatrician. Ladies, thank you for your time. The other very common scenario in as far as kids is concerned is cuts, because they do not know how far is too far, so they'll probably get themselves with the knives, with the scissors, with the razor blades, what have you. So how are you supposed to attend to such an injury?
Certain things that we need to have in the home or in our cars if we are traveling or wherever you could be is a first aid kit, because that is what could help you in those kind of emergencies. The idea is, when it comes to cuts, is to stop bleeding and making sure that you secure the wound. This is a painkiller gel that may not necessarily apply on a cut, but on blunt trauma you can apply that. We have bandage, different types. These come in different sizes. Then you have what we call some gauze to just wrap around. You could also have cotton one if you do not have gauze. Then this is a blanket, optional. In a basic first aid kit, you may not have it,
and this
because
is
you can use. This is for burns. In burn cases where you want to really cover and protect heat loss, this is what you may use. And also just to give you a surface where the child could lie on. Then we have a pair of gloves. These are sterile gloves. You could also have just normal, ordinary clean gloves that you can use for cleaning. Then we have a pair of scissors. If you do not have that, you can use the surgical blade. They are available, because you will use this to cut the gauze, but preferably a pair of scissors. Then we have eye drops in case of injury to the eye and you need to dress the eye. We also have eye pads. If you have any kind of injury to the eye, you need to pad it, strap, and go straight to the hospital. Then we have some alcohol-based kind of small pieces of alcohol pads. These are for cleaning surface. If you do not have this, you could have spirit, and you can use with either small pieces of gauze, and it will give you the same kind of alcohol pad.
What if I don't have any of that? Can salt and water work?
You will use warm water and a pinch of salt, but warm water alone is preferable, because sometimes when you put excess salt, again, that may suck in part of that skin. So warm water alone is good. The rest are clips and safety pins. And once you put the crepe bandage, you could pin it up so that it doesn't come out. So for cuts and wounds, the first thing is to arrest the bleeding. Put pressure on the cut if it's a small cut. For bigger cuts, that may be difficult, but we do pressure dressing. But make sure that it's not too tight again, because too tight means your hand will not get good circulation. Yes. Then if you have some spirit, make sure you clean around and then you dress.
Okay, for those that are old school, or maybe it's still used nowadays, you would hear after you've cleaned the wound and it's good to go and it's not something that you need to see the doctor, you apply that purplish thing. Was it called GV or something?
There's GV, there's, now we have betadine for cuts that can be used in the home setup. Those are antiseptics to prevent infection into the wound.
So the other thing that most parents will probably be very scared of and have had to deal with is drowning. It could be in large surfaces of water. We're talking about swimming pools. It could be in a bucket. A curious infant who just find themselves toppled into a bucket. What's the first reaction to this kind of emergency?
If the child falls into a bucket full of water or a basin, or they could be in a pool. So the first thing is to remove that child from whatever source that is. Place the child on a flat surface. Ideally, this would be maybe on the floor or on the ground, wherever it is that is flat. So the first thing is to see whether is there breathing. So if no breathing, the next thing is you check for the pulse. So circulation. So you will look at the middle of the neck. The middle of the neck gives you usually a hard surface. It's a bump. That is where your windpipe and your food pipes are. You just slide your finger either to the left or the right, just finger breadth. You will be able to feel the pulse. If there's movement, it means then we are still alive. So the next thing is you want to give some resuscitation, so what we call the CPR. So basically just to bring the child back to life. So in a small, in an infant of less than 1 year, you need to be able to identify, get your landmarks, identify the position where you're going to do the compressions, and then we are going to do the breaths. So the nipple area usually is the middle of the chest. Then once you identify the nipple, just a finger breadth below, that is the position where you're going to give the compressions in between the two sides. So first is to check airway. If there's anything you can remove it immediately, because that could actually make the child start to breathe. If nothing, then we are going to give the compressions. So in a neutral position for infants less than 1 year, all in one line, then a finger breadth below the nipple area, and you give the breath, the compressions. So about 1.5 inches. Okay. So you do 30 in a minute. Okay. So it's a bit faster. Then you observe. If no breath, you're going to give some breaths, rescue breaths. So you give 2 breaths, 30 compressions. So to give the breaths, you can do on the mouth. You breathe into the mouth twice. Make sure that the chest is rising. If not rising, after the 2 breaths, you go back. Give another. At this time, you're calling for help because you can't do this one person. If you're 2 of you, one person can do the breaths, the other one is doing the compression.
Okay, at this point I think I'll ask, because we see people who do CPR kind of hold the nose and then put in the breaths. So for children it does not apply.
For an older child, above 1, you can, because the idea is to make sure that you create a seal. So the older child, your mouth may not be able to cover the nose and the mouth. It's equivalent to using a mask. So in a hospital setup, we use mask and the mask usually covers this area.
You revive them, they probably even cough out some of the water that had gone in. Are we in the clear, or do we still need to seek medical help?
Once you establish some breathing, or already there's some help coming in to go to the hospital. One, because drowning, mostly your lungs get affected. Near drowning also needs to be checked, because you could accumulate a lot of water into the chest. So you're doing that as you wait to go to the hospital.
How many parents actually have this skill? CPR is literally life-saving.
The statistics tell us 8 out of 10 parents do not have basic first aid skills, which is very alarming. And you know, the other thing about basic first aid, I always tell people, you learn basic first aid, you get the confidence to do something when you're in that moment of crisis. Because you could even be a first aider, you could be a doctor. But when that is happening to your daughter, right, or your son, right then, you could be in a frenzy, you could panic and all that. But I think what I've learned, and even in situations where I found myself having to practice first aid, at the end of it, I am surprised at just how I got into the situation, calmed everyone down. So I think learning basic first aid helps you to get the confidence, because you know what to do. What puts you in a position of a panic and disarray is when you don't know what to do. Yeah.
Okay, at that point, we take off our short break on Health Diary. When we come back, a lot more of accident scenarios within the home that have to do with children. Remember, the conversation is pediatric first aid right after this break. Welcome back to Health Diary, our conversation, pediatric first aid, and clearly just from what we're learning today, there's some things we've been trying to do or have been doing or think we know what to do in case of an emergency, but these would actually aggravate the situation further. So to help us have that conversation again, Alice Kibagendi and of course Dr. Super taking us through this. And let's talk about kids putting stuff up their nostrils, in the ears, and oh my God, that can make you go, go crazy because you don't know what to do. Yeah. First instinct would be to probably pull it out, but I am told that's not the way to go about it. So what do we do, Dr.
Again, you'll see a lot of that, what we call the foreign body kind of incidences happening in between the 1.5 years, because they're picking things, and they have now developed to the extent they can pick a bead, because that is a skill. So they can pick a bead, and now they also know that there are certain holes in your body. So they'll even come and start poking your ears, your nose. So the first thing is, for an older child, if it's in the nose, assuming it was put by a smaller child, they could try to sneeze out. If that does not happen, you could also be able to put something that is noxious, and you can place it here and see whether they sneeze out. Depending on what it is, if it's a bead, it can come out. But if it's something with a sharp object, sneezing out may cause damage as it comes out. You don't pull out with sharp objects, because if you have a round object that has gone in, the more you try to pull, the more it goes inside. So you do not remove what you cannot see.
The other thing you hear is probably put either oil, olive oil, something slippery into the area, and for some reason the object will slipper itself out.
Well, it could slip in. It could slip in. Yeah. So again, that may not work very well, because then that is naturally your nose may produce some mucus, and that mucus may come out with the object.
While still in the ENT area, in this case, how do we deal with nosebleeds?
The first thing to do is to stop the bleeding. So in nosebleeds, mostly the area that tends to bring the bleeding is in the middle of the nose. That is where you have your blood vessels that are likely to get ruptured and blood comes out. So you put pressure. So pinch, you put pressure on both sides. Of course, making sure that the mouth is open, because the minute I pinch here, the child will open the mouth to be able to breathe. So put that pressure, release. If it stops, that is good. If it doesn't stop, you can have a piece of cotton wool, roll it and you get a longer one, not a small piece, because if you do a small piece, you should roll one that comes out of the nose. Then you can moisturize it, then put it in the nose to apply that pressure. That is after you pinch and it's still not stopping.
In school, I saw children being told to sit down, put their heads between their legs and pinch looking down. Does that work?
Yes, it does. Because the idea again is to, one, you look down to prevent the blood from dripping backwards. If you pinch and it's this way, you could be bleeding from behind. And you won't see, it will stop, yes, from flowing, but it may be flowing backwards.
When you're doing your trainings, is it imperative that you also let them know what they need to put in their houses that would come in handy in such instances?
True, that is the entire purpose of Amara Initiative, creating awareness, because there are things that you probably would not intentionally have in the house just for the purpose of when an accident occurs, but it's important to have a cabinet, a drawer, a box where you keep certain things. And also I think we also have an attitude of reacting to things, because I find like people ask for basic first aid either because it's required or because they heard of an incident somewhere. So I'm trying to tell all of us, let's be intentional. Get a first aid kit, check on the net what needs to be in it. You can even fill it yourself or check online and see where you can buy one.
Okay, Dr. A child this age has fainted. They've lost consciousness. Panic is my first instinct, but what can I do to help the child?
Reduce the clothing of that child, because you want them to have some good ventilation. If it's in a closed room, open the windows, because you want in more air. After you have exposed and they are able to be in an open space, it's well ventilated, you may actually find some are able to wake up immediately. So then the next thing is to see, was there any secretions around there? Then you can wipe that, clear the airway. Some children may faint or lose their consciousness because their sugar is very low. If you already know of that, that is the cause, you could then, once they are in well ventilated, they may start to wake up. You need to give some sugar. So you may give some sugar in that, and some it could be the pressure went down, and therefore they need to drink in something to increase their pressure in the body. If it's after a seizure, you do not need to do anything in the mouth. So just position the patient in a recovery position. So the recovery position would be, they would go to this kind of a position. You want them to open their airway. So they lie down like that. Okay, recovery is always, so you can have this one is folded upwards. They just, and then this in a relaxed manner. So that opens your airway, not this way, but on the side, recovery position. If no breathing, you go through the same cycle of CPR.
So now you have a child getting a seizure and there are some vital organs that could be at risk here. What do you do to help them along as you wait for help?
You need to make sure that there's good ventilation, because when they're having a seizure, the brain needs oxygen at that time. So they need to make sure that they're breathing. So ensure you're well ventilated. It is not in a hot environment. Remove any object, because some of them may be throwing. If they have something, they were holding something, you can gently remove it so that it doesn't injure them during that conversion. Then immediately, once some of them, the seizure may go on for a long time. But plus that, making sure that the airway is open, so you could tilt that slightly, the neck. But at that time, do not, if you try to restrict that, then that does not stop a seizure. And after a seizure, you may find some of them are frothing, so you clear that, clear any kind of secretion. Some of them may pass urine, so you clear that and make sure that they're in a safe environment.
So we're told, even for adults, that you need to put something in their mouth when they're having a seizure so that they don't bite on themselves or their tongue. Is that the case for kids, or does it work differently?
Most of the time, the movements would involve the mouth, the hands, and the legs. Most of the time, maybe not the whole body, it's hands, the legs, and the mouth. So make sure that that airway is open. So when you're placing whatever object it is, you may actually obstruct the airway. So it's not advisable to put that. However, you may position the child in a way that it makes that airway open, and you can place your finger here on
Under
the jaw.
the chin, okay.
So just on the chin, below the jaw. Once you place that, the airway opens. The mouth actually will open.
All right, I think just having this conversation, so many myths have been busted, and it's critical that we have such skills. And somebody would be seated somewhere wondering, where can I get these skills from?
We do have classes where we have specific groups, because sometimes I feel like if we're having a class of nannies, we need to take it at the speed of the nannies. We want to talk to them in a language that they can understand. Yes. Because sometimes we've had people coming for training and the nanny is saying, don't even give me a book, don't give me a pen, I don't, because some of them are totally illiterate. Some of them may not move as fast as you will move in the classroom situation. So we do have tailor-made classes. If you can reach us on Facebook, we'll be happy to get in touch with you and create something specifically for you.
When these mothers come, individual mothers, we also give them a few tips, especially as the child is growing, what they need to observe in the home. So we don't just teach them about feeding, but child safety is very important. And also some training in schools where we have a lot of injuries, especially the falls. Sometimes it's they go for swimming classes and you get
Accidents
drowning
happen.
episodes. So there are different forums where we need to be able to build that the skills, so that then in a school where they have swimming going on, do they have lifeguards, and the children themselves, are they equipped with basic skills? What do they do if one of their own is in a drowning situation? So we have those different forums. We just need to increase the training. Yeah.
And definitely awareness of basic first aid is important at all levels. It's just that we're focusing on the pediatric because the kids are the most vulnerable, and I think most people go into a panic because they don't know how to help a child. Well, thank you so much for all the information, ladies. Dr. Supatunje, pediatrician, and of course Alice Kibagendi. You are a parent and the founder of Amara Initiative. Thank you, and I'm sure you've gotten a lot of knowledge out of this. If you'd like more information, the ladies are available to give you the same. But for now, we'll take a look at the health tip. Emergencies can happen anytime, anywhere. You should always be prepared to provide first aid treatment to a person who has been injured or has suddenly become unwell. There are 3 basic C's to remember when conducting first aid, and they are check, call, and care. The 3 P's to remember and consider while doing first aid are preserve life, prevent deterioration, and promote recovery. Remember, basic first aid skills could save a life. I must say it has been a very informative episode of Health Diary. Thank you for the questions and the comments coming through on our social media handles. My name is Gladys Gashanja and we're coming to you from the Park Inn Radisson here in Westlands. Until next time, take care.